Hi guys, welcome to Saaj Cars and Tech. Saaj here. I got Vivek, I got Priya, and I got Nadia on the line. Vivek was part of my COVID podcast that we did previously, and I got Priya here and Nadia here. Priya and Nadia, do you want to introduce yourself?
Sure. So I'm Priya. I'm actually a sports medicine and interventional spine specialist in New York. And yeah, we're going to talk about some things related to COVID.
And my name's Nadia. I'm actually a sports and interventional spine physician as well, but actually up in Boston. But Priya and I know each other from training.
Interesting. So I want you guys to really do your plug at this time because the Priya and Nadia are starting a page and they're it's kind of new, but it's going to be big. I personally think. Do you want to touch on that real quick, Priya?
Sure. So we're trying to start a page. It's called Two Sports Docs, and we're both sports medicine. We're going to be board trained in sports medicine. And so our goal is to kind of create this page to lay out in layman terms what sports medicine actually entails, which is a lot of musculoskeletal issues like shoulder pain, knee pain. We'll also touch on back pain. And our goal is just to create this page where we kind of give out all this information, talk about most common syndromes, treatment options, and then bring in some speakers to touch upon it as well when we talk about treatment options. Nadia, I don't know if you wanted to add anything to that or.
No, I think that was pretty good. I mean, the only thing I would add really is I know there's a lot of doctors that have social media, but a lot of them are kind of doing it by themselves. And so Priya and I thought it would just be really innovative to have a combined idea just because we both practice in two very different metro areas, see very different patients, and we just want to provide as much education as possible for the people out there.
Nice. So everyone, please follow Two Sports Docs. Their Instagram handle will be in the description. And now I reached out to Priya last year to talk about COVID because even though she's doing sports medicine, they took a whole different path. Or they were kind of forced, right, Priya? You guys were forced to kind of take a different path.
Yeah. So Nadia and I were, so we actually met in fellowship in New York City. And so we met around June when beginning of July when we started fellowship. And things were going great. And then around like February is when, COVID we heard about it and it was slowly coming into the US, but it wasn't up until March where it really became a thing. And basically our whole fellowship came to abrupt halt. And then when things were getting really bad, they needed all hands on deck. And we were kind of, quote unquote, they called it deployed, like they say in the military. And we were reassigned to different units. And we were asked to cover COVID patients. And it was a completely different ball game from what we were used to. Because when we do sports medicine, it's mostly outpatient work. We really didn't work anywhere in the hospital setting of inpatient work. And this was completely new.
Interesting. And how did the training go? Because I mean, you're not dealing with any sort of viruses on a daily basis. This just came out of nowhere for you guys. How did they bring this to you and say, "Hey," did they throw a book at you and say, "Hey, try to learn this stuff," or did they try to? I know the information wasn't all there when it was introduced to you guys. Can you go explain that a little bit?
Yeah, no, I mean, I think part of it was just like, I remember calling Nadia and we're like, what are we going to do? Like, we pulled out our intro books that we had when we did intern year, which was like 3 to 4 years prior. And we were trying to read up things. And I mean, Nadia, you can comment on this because they broke us up into different cohorts, different teams, because as much as they needed everyone on deck, they also recognized like, hey, this is a big undertaking. We need to give them some room to relax after they cover. So they did different shifts. So we would be on for 4 days and then off for 8 days. But unfortunately, Nadia was in the first cohort. So I remember, kind of being grateful because I was like, okay, she's going first. I know she's going to give me all the information. But Nadia, I don't know if you want to speak to, kind of what you were feeling when you were asked to be on first.
Yeah, I mean, so I think the important thing to remember is, we know a lot more about COVID now that it's been a year, right? But when this kind of hit really hard in New York City in March, we didn't really know much of anything. So we just knew COVID really hits your lungs hard. It gives you, respiratory distress syndrome, can put you in the ICU. You may end up intubated. So what we ended up doing is, since we hadn't done medicine in almost 4 years at that point, like Priya, our other colleagues and I, we just started reading about lung disorders and how to treat lung disorders. How do you manage like vent settings? We were trying to like get in touch with friends who are in like critical care and like internal medicine to get their take on stuff. So it was just kind of like, you're basically kind of thrown in. They try to provide us as much as they could. The internal medicine team in like the hospital was great. They gave guidelines on what they were doing even before we all kind of came in to help. And then, yeah, like Priya said, I was in the first team of people that came in. So we were broken up basically into teams where we had, 2 attending physicians who were like the senior like team members. Then we had like 2 fellows and then like 3 or 4 residents. So it's basically like people at different levels of training kind of working together. And I think we had like a team of like 5 or 6 basically to cover half the floor, which is usually anywhere between like, I think it was like 12 to 15 patients. And we would just pretty much go in the mornings, check on all of the information for every patient, kind of provide each other as much support as possible, lean on their internal medicine colleagues a lot. And that's kind of how we learned what to do. And then as we went forward, we got, it was still scary, but we got a little bit more comfortable in what to look for and what to manage.
Yeah, and I think the interesting point of that is when she talks about the teams, it was teams of orthopedic surgeons and like physical medicine rehabilitation doctors, which was our specialty. So it was people who were very much far removed from the inpatient side, in charge of covering these patients, because they just needed doctors. Essentially, if you were a doctor, you had some sort of knowledge to deal with this, which is true. And we weren't like, oh, why do we have to do this? We were glad to do it, but it was definitely scary to know like, hey, we don't have information. But then the truth was, even the internal medicine doctors, they only knew as much as they could learn every day. So it was definitely a real life, like in real time learning experience.
What would you say is one of the most probably the like challenging parts, whether it's the patients, the politics? What really made it difficult for you besides the lack of information that you had?
So I think for me, it was definitely, and I use the term PTSD, and I know that's a very strong term to use because we usually think of those in the military and those who've gone through really traumatic experiences. But I lost a 30-year-old patient, and I still see his face. Like it's one of those things where you're losing people. It wasn't that people were just sick. People were dying, and you were the last one that they saw because they couldn't have family members there with them. And so it was just, that whole experience was definitely, it was just eye-opening, and it made you really appreciate life and health. And I know Nadia can speak because she had a really horrible first day as well. So
yeah, my first set of coverage days was actually the official peak week in New York City. So it was like that first week of April. We lost a number of people that week, and it was harrowing because, how Priya mentioned, like the hardest part I thought was patients were by themselves. The only family they had in that moment was their physicians, essentially. So, and it was like strangers taking care of strangers like they were family for us. And you never knew when like the code was going to go off overhead. So like they would call a code basically anytime anyone went into like cardiac arrest or like respiratory arrest, and like you need to basically run to that room and try to revive that patient, whether it be like through chest compressions or intubations or medications or whatever it is. And that first week, we would hear that code and you hear the code essentially all across the hospital, but you hear it first and the loudest on your floor. And each of those first couple days, we would hear it essentially like 4 or 5 times a day. And unfortunately, almost none of them survived because a lot of times before the code was even called, they had already passed. But we would still put in like 110% of effort to do anything we could to try to revive them. But I got to the point actually, and I think Priya makes a good point about the whole idea of PTSD in a sense, because it actually got to the point where we were like afraid to leave the floor for anything. Like we didn't want to go and get food from somewhere because what if they call a code and we're not there to answer it? So that first week was really rough.
Priya and Nadia, this is Vivek. I want to ask you a question. So obviously 2020, looking back, hindsight's 2020. If you can do something differently structurally, what would it be?
I think that's
like
an
in terms
interesting
of
Whether it's, some government policies, perhaps providing you better resources, better guidance, better IT systems. If you had, let's say, a wish list of things that could have helped you support these patients during the April timeframe, what do you think that could have been?
I mean, in terms of just, and I know we worked on this while we were on the floors of our hospital, but like the whole idea of connecting with loved ones, because obviously they weren't allowed in because it was so new. We didn't know what the risk was of, spreading it and stuff like that. But having like iPads readily available, like at a certain point, I was using my own phone, putting it in a Ziploc bag because we didn't know if, touching surfaces would spread the virus and whatnot. But having some sort of technology available so that these loved ones could connect with their family members who are in the hospital and at least speak to them versus having zero communication, really no way of identifying like what was happening to their family member if they passed away, finding out like hours later, and then really trying to get like either their bodies back so they could do a funeral and stuff like that. It was very chaotic, and rightfully so, because it was the sheer number of people. A hospital system is sustainable by a certain amount, and we realized like our system was not sustainable for the amount of people we saw, and that explained why we were expanding. Like we were the hospital that had to create a hospital in Central Park and in our lobby, and you saw this across the nation of people just trying to expand as of it. So we were kind of expanding, but I feel like maybe more using that whole IT platform and really trying to get people to connect to their loved ones is at least something I saw that could have just helped in the ease of this whole process. But I don't know if Nadia, you have any other.
No, I think that's huge too. And then also, I guess, just getting information out seemed to be like an issue. Like, part of it was like we didn't know, or no one knew like what information was accurate and what wasn't. But just having some form of centralized way of like disseminating like, hey, we should wear a mask in these locations because it's a high risk situation, or like or even in the hospital setting, like if the patient's vitals get to a certain number, like that's a high threshold that you're going to have to like escalate that patient to a different unit. So I guess, like you said, hindsight is 2020. Now we kind of understand a lot of those things better, whereas like then we were a little bit in the dark.
Yeah. No, those are two good points. I mean, telehealth and the lack of information. Looking ahead, I want to bridge two concepts. Not two concepts, but two events. One is the pandemic, obviously with COVID-19, and two is this emerging trend with telehealth and its adoption. How do you guys see those two merging?
So I think we realized like our department was trying to get into telehealth even prior to the pandemic. But this pandemic definitely boosted the importance of telehealth, because if you can have access to your doctor from the comfort and safety of your home, then that's a huge plus, because you can still get the care you need and the attention you need. But with that, the caveat is obviously through telehealth, you can't physically examine a patient. And so for our profession, there are certain things that you can definitely do via telehealth, but then there's other things where I would need to physically examine someone to really decide, okay, is this something that needs surgery or doesn't need surgery? Because that's essentially what our role is, and what we do is figuring out, when we can manage all these conditions non-operatively, or we need to send it to one of our colleagues. So it's definitely been an interesting transition, and we're still kind of living through that.
Nadia,
So
do you
what?
want to add or
Yeah,
something? Go ahead.
go ahead, Nadia. Do you have anything to add for telehealth?
I mean, I thought telehealth was huge during the shutdowns because if you imagine like every subspecialty that did any kind of outpatient care for patients was basically covering COVID at one point. So now you have all these patients that still have, back pain, still have diabetes, still have high blood pressure, and they can't come to their doctor's office. So I know telehealth in that sense was huge because when those who were covering COVID were off cycle, like during those 8 days or whatever days you were off, you could still like reach out to your patients and make sure that they were still taking care of themselves, that they weren't like falling by the wayside. And to this day, there's still times, depending on the number of COVID cases in the States, where like certain things still get shut down. So it definitely provides an opportunity in that sense of like, still being able to triage to a certain point, like, how a patient is doing, whether or not you need to do something for them or get them to someone's hands if you can't be the one that can take care of them at that moment. So I think telehealth has really proved that there's a lot of positives in a lot of ways. And I think it's here to stay at this point.
Oh yeah.
No, I definitely agree with that. Like, it's just a perfect example is we had a huge snowstorm this past Monday, and literally every single service, they switched all their appointments to telehealth because you can still see your patients. It might, not be exactly what you imagine, but you can still address their concerns and treat them. So I agree with Nadia. It's definitely here to stay. It's kind of bridges that whole access to care gap that, a lot of public health officials are always talking about is how can we increase access to care to people, and telehealth is a way to do that.
Yeah.
So,
I mean,
what would you guys do to improve telehealth based on what it is? It's still kind of young, and I think the potential is there to make it even better. What is your thoughts on to make it better?
So I would say one of the things that we actually ran into while I was still in New York City was just the availability of technology for certain individuals. So not everybody has an iPhone or a laptop or something that they can just do that on. And I think we take that for granted sometimes until we realize that there are those patients who don't have access to those kind of things. So if there was a way to create, I don't know, this kind of makes me think of like telephone booths from like back in the day where like, people to make a phone call, you would like put a quarter in to call someone, right? But if there was a way to, I don't know, create like some kind of public access to like a laptop or something where like those patients who don't have access to it at home can still access their physicians via telehealth, if that was their only option.
Yeah.
Interesting.
One
Go
thing
ahead.
I would add is when we think about the question of how do we improve telehealth, I think government in this case really has to lead the front, and particularly in reimbursements. And they have, I think, in recent times, and both of you correct me if I'm wrong, but having providers incentivized, right, in terms of being reimbursed, getting paid for the same level of service that they would in person, I think it would definitely push us a long way. Historically, that hasn't been the case, and I think that was one of the reasons why there was a low adoption around telehealth. That may have changed since the pandemic, but I'll let you guys chime in.
Yeah, I can add, Vivek, that it actually has, and it's changed for the better. At least for video and audio combined visits, the reimbursement is actually the same rate as an in-person office visit. If you do just simply a telephone encounter, like there's no video component, then the reimbursement is still like lower. There is a billing code for it. It's just, unfortunately, it is lower, but if you think about even pre-pandemic times, we make multiple phone calls a day to patients and wouldn't get reimbursed anything for that. That was just extra on top of your regular work. So, I mean, that even in and of itself is still a positive change or an incentivized change for better communication and contact.
Absolutely. Any thoughts, Priya?
Yeah, no, I mean, I agree. Nadia has more experience of using it, more so than my department, because my department hasn't adopted to it. It's because I work for the Department of Orthopedics. So they strongly believe that we have to see patients in person. But But I definitely see the utility for telehealth and how it can help patients. And I agree that they've definitely made strides in making sure that physicians are getting reimbursed for it. Because like you said, you need an incentive to do it. And so with that, I'm hoping that it'll be more accessible and people will continue to use it.
One of the things I see regarding telehealth are the emerging technologies, particularly with 5G. You know, as the way we understand telehealth now, it's more of this primary care-like encounter. But you know, with the advancement of 5G, whenever that happens, I think we could be doing remote surgeries, some of these more complex procedures remotely through this use of 5G. And I think that would in particular help a lot of these rural communities that don't have access to these hospitals.
Yeah, I mean, it's definitely a possibility, and there will be advancements for that. I mean, we see robotic surgeries for certain things that are available, and people can control it. For what we do specifically, which are more like ultrasound guided injections or like fluoroscopy guided procedures. Fluoroscopy just means X-ray guided procedures. For that, I don't see that going away anytime soon without having like someone who's trained in that, specialized in that, because it requires a use of machinery versus like your hands for doing the injection. So I think that will still be in play. But like you said, you know, I'm excited to see where the advancement of technology goes, especially in healthcare.
Absolutely.
So one thing that I want to touch on is the hospitals. You guys definitely had quite a bit of experience, well, a really tough experience this past year. How has that changed from a regular hospital visit to what it is now, where, you know, right now they're asking all the questions, do you have these symptoms and whatnot, and you're wearing a mask, you're sitting, and then get called in. They want to get you in and out as soon as you can. Um, how has that changed from what it used to be to what it is now? And how are we looking in the future? Are we? I mean, I know the one thing that, in general, one thing that I've noticed is a lot more people are hygienic now. Like I see more people washing their hands. I remember I used to go somewhere and you would see someone leave the bathroom without washing their hands, and you're like, this is disgusting. And now all of a sudden, the when the pandemic hit and everyone's like, oh, I've got 14 seconds, I gotta wash my hands, I gotta wash my hands. It's a bit different now. How do you guys see the hospital from where it was to what it is now, and what's coming up in the future?
Yeah, so I mean, I definitely see me personally just being more cognizant of the fact, like, okay, even before, because it's communal keyboards, communal computers, like our clinic isn't just like we're the only ones using it, people come in and out. I wipe down everything before I even sit, including my chair, including everything. That wasn't something I was doing before. And then and that's not just me, that's every other provider. Making sure before you would shake hands with the patient, now it's, you know, you're not even doing that. That personal touch has definitely come out a little bit, but you put on gloves and then you can still shake their hand. In terms of clinic visits, like visits are spaced out. You know, we don't double or triple book as much anymore because you just don't want people congregating in the waiting area. Before I enter the hospital, I have to fill out a questionnaire every single day, which asks like if I traveled anywhere, if I have any symptoms, just to prove like it's a screening tool for them, and they make every person that enters, doctors, patients, anyone enters the hospital has to fill all this information out. So they've definitely made, you know, a lot of these check points to try to make sure they're minimizing as much exposure for other people in the hospital. But you know, it's still very difficult because with COVID, a lot of these symptoms, you know, some people have severe symptoms and other people's are asymptomatic and you just don't know. So they do their best, but I think hopefully the hygienic part and wiping everything down is here to stay.
Nadia, do you want to jump in on that?
I don't know if I have too much to add to that. I think Priya really hit it. I think a lot of hospitals are doing a lot of these same things because they found that, you know, the best way to try to mitigate, you know, the risk of exposure has been, you know, constant checking both patients and employees. Obviously, like, you know, I think we're back to kind of wearing like double masks in some situations because of all like the COVID variant information out there. Lots of hand washing between patients, before patients, after patients. But yeah, I would agree with both of you guys. I think if anything, like the level of hygiene has definitely gone up quite a bit.
For the good.
So
For the good.
there's one thing that Nadia you just said that really reminded me of something, and that has to do with the masks. How did supplies really, or lack of supplies, really affect you? Because I know I was talking to Priya last year, and I said, "Hey, how is it going?" And she kept it really brief. And I know one of the things was we don't have enough masks, and I know that was like not just in New York; it was everywhere. What else did you guys end up like, hey, we need supplies, we need this? What are the difficulties did you have in terms of logistics?
I think masks were the biggest thing. When it first started, no one ever anticipated that we were going to need so many N95s. And so in the beginning, we were actually kind of like reusing our N95s for a few days at a time before they would get recycled, basically, and we would get a new one. But with that said, as soon as like our hospital kind of figured out the direction in which this whole thing was going, they really ramped up trying to find all the supplies that we needed. There was never a day where I walked into the hospital and I didn't have the masks that I needed, the gowns that I needed, like the face shield that I needed. And I know that there were places in the country where that wasn't the case. And that there were people who like didn't have what they needed and actually had to try to go buy it themselves. So in that sense, I think we were quite lucky in a lot of ways, but maybe Priya's got something else to add to that too.
No, I mean, I agree. And I think our hospital did a great job of what they did is on our floors, they created different zones based on colors. And, if you walked into this zone, which was usually like in a patient room, just remember, hey, you're wearing your N95, you're wearing a surgical mask on top. Like after you walk out, like remove your surgical mask and replace it with a new one, or you have to make sure you gown up at this certain point. So they definitely had everything available, but it wasn't like they had a limited amount of resources. So they gave us face shields, but they, taught us, okay, this is the proper way to clean the face shield when you go in and out of rooms. So it was definitely helpful that we had the support that we needed, but it took a while there. Like it wasn't like, oh, right when it first started. And I think I brought up that mask point because it was towards the beginning, when they were like, oh, you're gonna go out and like cover this sporting event. And I remember being like, okay, well, if we're covering this event, like COVID is like still, people are, it's here in the US, like shouldn't we take precautions? And at that point it was like a scarcity of masks then. So it was definitely interesting, like the month, 2 months prior to when things really peaked. But at its peak, when we were asked to cover, we definitely had enough supplies, which we were happy about. But like Nadia mentioned, that wasn't the case across the country. So I can definitely see where providers were scared to go and work because they didn't feel adequately prepared.
One of the things that I want to kind of switch towards is we have a good understanding of the past, right? In terms of the challenges, things that we could have done better. I want to talk a little bit about the challenges that we have now, and that is the vaccination aspect of things. We have about 300 million people to vaccinate in a short amount of time. Given all of the things that both of you learned and some of the downfalls, how do we vaccinate 300 million people in at least the US, given all the constraints that we have? What is your guys' path forward?
I mean, I think for me, it's just organization. Like as simple as that sounds, it also is very complicated when you talk about, different counties and state and federal support when it comes to organizing. And an example is even my hospital, I remember when I was waiting for my second dose, I personally waited 45 minutes, like being a provider and waiting for my second dose because they had called all these people for the first dose, but then the vaccine itself wasn't ready because you have to take it out of the vials. You have to make sure it's like refrigerated at a certain temperature prior to taking it out. And the logistics behind it aren't as easy. And so making a clear organization plan would be so key, but unfortunately that's not as easy as it sounds. And I think it's Israel that kind of proved that they created like an app so people can book their appointments right away. They knew exactly where they were going. And they've been pretty successful in vaccinating people. And unfortunately, we just don't have that. And I know firsthand because I'm trying to get my in-laws vaccinated. And me being a provider in New York, it's still hard for me to be like, okay, this is what you contact. This is this is where you can go. Like I'm constantly looking for information, up-to-date information to try to get them vaccinated. So I think it's just the lack of resources online, or if we don't have a central hub to tell patients, here, this is where you go, this is where you can kind of get information on testing or vaccination sites near you, and this is how you sign up.
Yeah, absolutely. Nadia, any thoughts on that?
Yeah, I mean, that's definitely for sure the case. And I know a lot of times we're kind of letting it be on like a state by state basis. So like some states are doing a good job, some states are kind of struggling, trying to figure it out. And I think the other thing too is just production of vaccine. We've just been lagging, and there were like estimates of how many people should be vaccinated by like the beginning of 2021 or like by the end of January, and we just haven't been able to hit the target in a lot of these. And a lot of it has been just because we're just not able to crank out as many vaccines as we need. So it sounds like, and correct me if I'm wrong, if you guys have, more up-to-date information, but it sounds like they're like trying to see if they can activate like the Defense Production Act to try to get like more vaccines to more people in more places. So hopefully that'll be accelerating the process a little bit.
Yeah, my two thoughts on this. One is I'll provide an anecdote, which is for one of my work clients, who's a federal health client out in the Pacific Northwest. We were talking about the state of vaccines, particularly at that facility. They had about 60% of their vaccines used. The remaining 40% were not used. And so I asked the question of, why aren't you using them? Is there some delay? And she responded saying there's vaccine hesitancy. Folks are just not willing to take the vaccine for whatever reason. So I think that's one of the challenges when we're thinking about the barriers to vaccine. As far as the other point you mentioned, Nadia, about not having the raw materials or not having enough vaccines, I think in the end, the real entity that can really address this in terms of having the resources is the federal government. They have the money, they have the resources, and they have the legislative power to really make this happen. And I think just today they announced some sort of Defense Production Act in which would allow the Pfizer vaccines to be deployed at a much rapid pace, just because they would be procuring a lot of these raw materials that are necessary for these vaccines. And so I agree with all of you guys. Tools, information, hesitancy, lack of vaccines in general, I think are part of the problem.
Do you think that it would make a difference if it was just one shot versus two?
I certainly am not the right person to answer that, so I'll defer.
That's actually a very good point, and I've thought about that myself. With that said, there is some talk now, right, of this like single shot vaccine that may get FDA approval. Granted, the efficacies and things like that are kind of like, a whole other conversation that we could have. But I do wonder if that would play a role. I don't want to speak for Priya, but I feel like for Priya and me, or like for those of us that are in healthcare, we were able to, get vaccines where we work. So we could finish seeing patients and then go at, whatever appointment time we had. And it didn't matter what day it was or whatnot. We were already there. But for some people, if they're having to travel to get it, if they're having to wait in line to get it, I can imagine it could be very difficult to find the time, especially if you're working, especially in a situation where every job is so precious right now. You don't want to have your job be at risk of you losing your job, to find the time maybe to go for 2 vaccines versus 1. That's a good point.
Yeah, no, I would agree. And I think it would also assess, like you can probably reach more people that way too, because you only have to deal with one vaccine versus scheduling them for 2 appointments, following up. If they're lost to follow up, then what happens, and the data is not as clear, like how long they can stretch it by like a week or two in terms of how long you can wait till you get the second dose. But what if you just miss the second dose altogether? Then at what point do you have to go get it again? And so I think if you're able to do things in one shot, in theory, it's easier. But like Nadia mentioned, in terms of efficacy, that's a whole nother discussion to be had.
So, how do you get people that are kind of against vaccines to take the vaccine? Because I'm not trying to play stereotypes, but some of these are the same people that don't want to wear masks. They're the same people that don't believe that COVID is a real thing. How do you get these people to take the vaccine?
Yeah, that's a good point. Nadia, do you want to add, or I can?
Yeah, so I think part of it is trying to find common ground with a lot of these individuals. And honestly, as much as we want to think that it's only the people that are like anti-maskers that are also anti-vaxxers, we have colleagues in the hospitals that don't want to get the vaccine. And these are people that we know to be educated, know to be in healthcare, know the up-to-date information, and they're still hesitant to get the vaccine. So I feel like some of it is like trying to find common ground with people, providing education to the best of your ability to what we know, considering, what is worse, the side effects of the vaccine versus the actual effects of the disease. And ultimately, all you can do is really provide all the information. People just have the right to make the choice that they're going to make. You just hope that they're going to make the choice that's going to be right for not just them, but the people around them. But yeah.
No, I completely agree. I think the education part is just the key component, and that's essentially all we can do is just educate and answer questions. Like I had a family member ask, like, oh, they're worried about the side effects. I was like, then let's talk about it. Like, let's talk about the side effects, and I can help you figure out how to like either minimize it or how to deal with it. Because in my opinion, it's, I still think it's beneficial to get it versus what the side effects will be. So it's just educating in a way, like Nadia said, middle ground as well, just because I agree with her. Like I have colleagues as well who, are very hesitant, and it's just kind of figuring out what their thoughts and rationale is. And if it's something that we can discuss, then great, and then we'll have that discussion. But other people just have their opinions, and it's definitely a very interesting time because unfortunately this pandemic has become political, and so that's a lot of times that's where the conversation goes.
One thing that I would also add on that, so in terms of the hesitation to vaccines, politics, upbringing, religion, I think all those things play a part. In terms of how to incentivize the individuals that are hesitant to take the vaccines, I think there are two ways we could probably do this. One is the stimulus. Just today, I think the Biden administration announced a $1.9 trillion plan to help the folks that are in need. I think attaching some sort of vaccination mandate could definitely incentivize people, whether it's putting a certain portion of the stimulus check as part of that or whatever it is. I haven't really thought of that. And the second, I think, is the employer side of things. Similar to how employers provide insurance, I think employers really have a chance to be the front runners on this. When I worked at a hospital several years back, I would have to take the flu shot, and I'm sure Priya and Nadia had to do the same. I think having employers play a leading role in this, I think, is another possible solution to addressing the vaccine hesitation aspect of things.
No, and that's definitely an interesting point. And that's something I brought up to my colleagues. I was like, oh, I wonder if they'll make this mandatory like the flu shot. But the caveat is that, if you decided to decline taking the flu shot, then you would have to wear the N95. which essentially has become a norm now because of COVID. So I think that's where maybe, you know, I agree, you know, the employer definitely taking a stronger role and creating mandates, but then you'll also have that argument of like, you know, if this isn't technically, they've done the research on it. Obviously, it was FDA approved to give these vaccines, but I think you're still going to have people kind of giving a lot of pushback accordingly. So there's definitely an interesting debate there.
Oh yeah, just the fact that this is so well ingrained into people, right? From politics to upbringing, the way they see their religion. This is something that you can't necessarily address through some regulatory action, and so there's definitely going to be some hesitancy, regardless of whether it's a government or employer playing into this. And so yes, this is a challenge. And you know, one of the other things that I had in mind that I wanted to talk about today was when we think about addressing this pandemic globally, it really requires the entire world to be vaccinated. One of the challenges we, of course, have are some of the developing worlds in terms of having access to vaccines, deploying resources, getting people to get vaccinated. How do you guys see that playing out from, you know, the likes of Africa or Central America? These new variants that are coming in place, I'm not the expert on this, but there's talks that, you know, it eventually mutates to the point that the vaccine may be ineffective. What are your guys' thoughts on that, Nadia and Priya?
I mean,
Yeah.
Yeah, Nadia, you can go.
So I was going to say, I think like you're making 2 points. So one is, you know, the whole idea of like, you know, we're so focused on then how do we get those countries that can't afford to buy the vaccine perhaps, right? So to that, I think some of that, again, falls back on the idea that I think we've relied on multiple times where a lot of the weller off nations often have to kind of step in and help some of the ones that aren't. I did do some reading on this, interestingly enough, recently, and there's been some talk of like, there's apparently a vaccine in development that is a slightly different technology than the mRNA vaccine that we have now. It's actually more like the more traditional vaccines that we're used to. And that's supposed to be so incredibly inexpensive in comparison to the mRNA that they think that they may even be able to provide that to some of the lesser developed nations at a reduced or no cost. As far as like how far they are in development, that I don't fully know. And like whether or not that's actually even an actuality is still kind of up in the air. But I think things like that are going to be huge. I think there's going to need to be kind of like, you know, those that can stepping in to help those that can't, but also some of this like generosity coming from some of these big multinational corporations that even put the vaccines out in the first place. Because I think everyone realizes that you can't just vaccinate yourself and your neighbors and then just start traveling and acting like the world is fine, because you're still at risk wherever you go, and you are at risk of putting other people's lives at risk. So we definitely are going to have to vaccinate everyone, right? And then, I'm sorry, Vivek, what was the second part of your question?
I think I forgot, but essentially the way I would say it, when the U.S., let's say, is vaccinated as a whole, it doesn't necessarily address the pandemic because
right,
other variants that are coming in place. So the question is, how do we really vaccinate the rest of the world so that this virus doesn't outsmart the vaccine?
Yeah, so I think one of the biggest things that's still up in the air is how long does this vaccine even last? Because as we know, the vaccine, you know, went through the development stages and the research stages fairly quickly. So they didn't really answer all of the questions yet. They answered questions regarding, you know, short-term efficacy and like safety so like, you know, for people that are getting the vaccine now. But even for us who have gotten the vaccine, we don't know whether this is like a long-term thing, whether this is going to become more like the flu shot where you have to get multiples. And with any virus, you're always going to have mutation of virus. That's the reason why we have to take the flu shot every year, right? Because the virus evolves continuously. And they're having to add like new strains or change the strains that are involved in the vaccine itself. So I think some of those questions are still up in the air a little bit.
Oh yeah.
So there's a possibility that we'll probably have to take this every year.
Definitely a possibility, I think. Yeah.
Yeah, I mean, it's so hard to tell, and unfortunately, it's also too early to tell. Like Nadia said, like, who's to say? We don't know how long this is going to last for. Like those who were vaccinated early on, like us, like healthcare providers, like, are we going to need a booster in a year or not? Like, only time will tell. And as they do more research on it.
Yeah, and I think
Go ahead.
Sorry, Saaj. I was just going to say, I think Pfizer and Moderna, at least the two of them, had come out recently and said that they believe, based on their research, that the immunity lasts for at least a year, but they haven't been able to say anything past that yet.
Right. Yeah. I mean, when we think of our audience on this podcast, I think a lot of them are Americans, our cousins, and et cetera. But I think one thing that I want to mention is the Russians came out with a vaccine, the Sputnik 5, it was called. I think they were the first one, even before Moderna and Pfizer. And at the time, they released data on their vaccine prior to the start of clinical trial 3. They just came out with information, I believe, this week, published in The Lancet, that this thing is efficacious, or whatever the word is, and it's effective, essentially. If that is true, and it seems like it is, the developing world, particularly the likes of Africa, Central America, and Latin America, could definitely benefit. And I know we're pro-American at all times, but this vaccine could be a game changer. Just one, because it's so cheap, and two, the Russians have offered to help. I'm not sure if you guys have read into that.
Yeah, now that you mention it, I think that might have been one of the things that I read too. And to the point of being pro-American, so we're all pro-American in America, but I think this virus goes beyond just being an American. I think this is about being human at the end of the day. So whether it's we as Americans, companies that can help the world, or Russian companies who can help the world, it should just be about whoever can help the world.
Agreed.
I completely agree.
Go world.
Do you think that people should have a choice in what manufacturer vaccine they get? Because I mean, there's going to be, like, you have Pfizer, Moderna. Johnson & Johnson is asking for the okay from the FDA right now, and that they're saying that's a one-shot deal. And then you have the vaccine that's in China, you have the vaccine that's in Russia, then you have the vaccine that's in India, and then you have a couple other vaccines that I've read on, but I didn't really engage on what countries they were from. Now, I'm pretty sure there's, like, there's so many different vaccines out there. Do they work toward the same way, or are they similar in somewhat aspect and just different names? What is your professional opinion on that?
I'll defer to the two, but I'll take one stab at it, which is, as the saying goes, beggars cannot be choosers.
Yeah.
Having said that, I would not take the Indian vaccine. But Priya and Nadia, I would ask you, if you had a choice between all of the vaccines that are out there, which one would you take?
I mean, so I got Pfizer, and I'm doing okay with it. I think, like you said, there's the aspect of beggars can't be choosers, but then as we practice, like, every patient has their right to, like, their own body and what's going in their body. And so we always practice, like, patient-centric care, and, like, putting them first and allowing them, just giving them information and then allowing them to make a decision. But in this specific scenario, when you have limited supplies of, this vaccine, I know in my hospital, like, someone asked, like, oh, I want this one. And they're like, well, we only have this one available, so you either take it or leave it. And I think in this case, it's like, the pros of actually taking it versus waiting and not knowing when you'll be able to get it again. Like, I would advise family and friends, like, whatever they have available, just take it. But that's with Pfizer and Moderna. Now, with these other vaccines you're talking about, I personally don't know too much about it. I don't know if, Nadia, you've read up a little bit more about them.
Yeah, very briefly. I feel like most of the information out there has been about Pfizer and Moderna, just because those are the first two that really got approved and were more mass available. The Johnson & Johnson one is actually the one that uses a different technology, I believe, than the Pfizer and Moderna ones. And then I don't know much, if at all, really about the technology for the Russian or the Indian vaccines. So I can't really comment on that part.
I think we all have a consensus that no one's going to be taking the Indian vaccine as of yet.
So,
well, I mean, I think that's the interesting caveat to that, and I don't know about this, but like, you know, to make those Russian and Indian vaccines available in the US, like, do they have to go through the same FDA regulations, or can they bypass that? And I don't know what that information's like, so I don't know how widely available they would be here in the US.
My thought on that would be, the U.S. government has enough doses procured through the likes of Moderna, Pfizer, and Johnson & Johnson, such that they may not even need the Indian and Russian vaccines. And speaking politically here, how would it feel if the president of the United States said that, you know, we're bringing in the Indian or Russian vaccine here?
Yeah.
Good luck, you know, one-term president. But I just don't. I just don't expect them to say that.
Yeah, no, I agree. I mean, I think there's definitely going to be a push for those three others, like you mentioned. But when you're talking about a global scale and, you know, making it available for other countries, like Nadia was talking about, it's, you know, just putting humans first and thinking about the world at large versus like political and continental divides.
One of the interesting things here is, when we think about the pandemic, we have to kind of go back to the root cause, which is China, Wuhan. How are they doing with the vaccines? I haven't heard much, and I'm not sure if you guys have, Saaj, yourself included. What's the state there in terms of how they're addressing this?
So I don't know, actually.
So I've been trying to read up on that, and there's not enough information out there, because I think we talked about this before, Vivek. It's they're not really transparent, and they're not really accurate with their information
Right.
at all the time. So it's when they are saying, "Oh, we're doing really good right now. Oh, no, you know, we don't need to wear masks and stuff like that." It's I don't know how to take that, like how I can trust that sort of news. So I've been taking it with a grain of salt, with, you know, saying, okay, maybe they are doing good, maybe they aren't doing good. You know, we're only getting like a fraction of whatever actually is going on over there.
I think the one thing that the Asian countries have an advantage over the rest of the world is their experience with SARS. It is common for these countries to use masks wherever they go, and in fact, I've seen it when I've been in that region, and so they've probably, as a result, done a little bit better. You look at South Korea, Taiwan, Singapore. When it comes to the vaccine aspect of things, I really don't know, and that's one of the reasons why I posed the question. Nonetheless, I still think the West, and you know, the likes of Europe and the United States, did extraordinarily well in terms of developing the vaccine, and so that's something that as a citizen, I'm pretty happy to be a part of.
So
No, definitely.
now, changing the gears here, let's talk about New Zealand, because they're like on the opposite side of the spectrum compared to everywhere else. Because I saw a TikTok. Don't judge me. I saw a TikTok on a couple that moved to New Zealand, and when they got there, they had to quarantine for 2 weeks, and they were given a hotel to stay at for 2 weeks, and they got tested 3 times by the government within that 2 weeks. Why is it difficult for why was it difficult for other countries to kind of adapt that? I know the logistics isn't there, but I mean, that the precaution there, I mean, look at New Zealand. They don't they don't have any cases.
Yeah, I think the biggest thing with New Zealand, you know, their population is definitely significantly smaller than what we're dealing with in the US. They're able to, I think their government definitely took a bigger stance and a more affirmative stance on being like, here, this is the plan, this is what everyone's going to do, these are the mandates, and everyone has to follow them. And that clearly shows that that worked, and they're able to live in this society that's technically COVID free, and they can quote unquote be normal. And so I think the US definitely has challenges when it comes to our population, our borders. We're a big transit hub, and which is why New York got hit in the state that it did, is because we have 3 major airports that people are coming in and out of, and you just constantly have people moving around and spreading this virus. So, and then unfortunately we had, a federal government who wasn't taking a more affirmative stance on how we should be handling this pandemic. So those are the challenges I see.
So based on those challenges from the past, now looking into the future, what are some of the lessons that you can probably take? Like, everyone says, let's learn from our mistakes. What are the mistakes that we have done as a country and that we can utilize to bring a better sort of procedure protocol in the future?
So I think the biggest thing for us in the beginning was mixed messages, right? So we were seeing what was happening in like Italy and China, and it looked like it was serious, but like we were being told it's not that serious. We have a couple cases here and there. It's not going to be that bad. We're going to control this. And I think there was a lot of delay even in the beginning in terms of like trying to tackle the seriousness of the situation. And then there was just more mixed messages about wear a mask, don't wear a mask, like, social distance, don't social distance. So I think the biggest thing to learn from all of that really is having a more uniform message. I mean, now we know how serious it is and how serious we should take it. Wearing masks, social distancing, good hygiene, like carrying that forward. I think even with the vaccine now, they're being very serious about making sure that everyone knows that just because you have the vaccine doesn't mean that you're now completely immune, that you don't have to follow rules anymore. Like, I mean, I finished both of my series of vaccines like 3 weeks ago now, I think. And I still wash my hands just as often as I did pre-vaccine. I am double masking in the hospitals when I'm working. I'm even still maybe even double masking if I'm getting on the subway or something in the city. So I think having like a more uniform message has been really important. Having a uniform message coming from people who are in charge is really important. Yeah, I think that's really kind of the biggest thing.
Mm-hmm. So we have 2 smart, talented individuals here, and I want to look ahead. I'll ask 2 rapid fire questions to both of you. First is, when will this pandemic end? Normality returns. The second is, based on how you understand things and sort of the epidemiology aspect of things, will we see another pandemic in our lifetimes? And I'll say us collectively, just because we're in the same generation. So I'd like to hear your thoughts on that.
Go ahead, Priya.
So in terms of ending, and I feel like this is like the biggest question we get, and honestly, like, it's so hard to tell. Obviously, some of these countries have proven if you have a strong response from the masses, you can find a way to quote unquote end any cases within that country. But we live in an age where people are constantly moving around, and so it's so hard to really tell when that will be controlled, because if you have a few countries handling it really well and other countries that are not, well, the people are going to be moving, and so then you're putting people at risk. So unfortunately, it's so hard to tell. And, obviously I hope and pray that it will be soon, because I know people are trying to live their lives. I'm trying to get married. So it's definitely, people have been putting their lives on hold because of this. And I'm hoping it'll end soon, but that's going to take a lot of effort from everyone, not just, the government, not just from individuals. It's just everyone has to come together and really, want to put all their effort into helping to make this end.
So it sounds like Priya is running for political office because she did not answer the question. When in a time frame will this end? And again, Priya, you could be wrong, or this is just a guess, really. If you had to take a guess in terms of month and year, what would it be?
I think it might be another year. What do you think, Nadia?
Yeah, I was going to say, I don't, sorry to the world out there, but I don't think 2021 is your year, but maybe 2022 is the year.
Yeah, I think it might take another year, just because what we're seeing with, like, obviously if we were being able to give them at a faster rate, but the rate of we're getting the vaccines out and then these new variants coming into play, like, it's just, I don't see this ending for at least another year.
Knock on wood.
Was that some sort of knock, Sergeant?
Yeah, I tried to knock on wood. Just
how about this? So Dr. Fauci has mentioned that this may be the prelude to the big one. Do you guys see a bigger one coming in the next lifetime?
Yeah, so I would say that, based on kind of what I keep hearing, on various reading news articles, hearing on podcasts, this is like the beginning of probably what will be maybe multiple pandemics, unfortunately, in our lifetimes. So I think rather than this being kind of like oh my gosh, like we're never going to be normal again, this should be like basically our way of learning how to hopefully control it faster if it happens again.
Yeah, I agree. Like, knowing what we need to do, what materials we need, how do we need to, kind of reorganize. I agree. It should be more of a learning experience than anything else.
Sanjan, I hope you're knocking on this wood again, because whenever this next pandemic happens, I hope we're all here on how this thing worked out. But no, I agree with you all. It's the future is uncertain.
Yeah.
Well, it seems like there's many ways to prevent it. It's just once it happens, it's hard to control it.
Yeah, unfortunately, that does seem like what it is.
I have all my topics covered, Sajan. Do you feel like we hit on everything?
Well, I think I do want to take a moment to really thank you guys, Priya and Nadia, and all your colleagues, all the frontline workers, to really thank you guys for really stepping up. It's not something that anyone expected, and it's not something that anyone asked you to like forcefully told you, hey, you have to do this, otherwise so and so is gonna. It wasn't a threat, but if you guys basically held on to your moral values and kept going, and you guys looked forward for the humanity first. I really want to thank you guys for that.
Oh, thanks for that.
Yeah,
thank you.
One thing I would add is, I was talking to Priya yesterday, in fact, and one sense that I got was, when we think about the vaccine, and I'll include you in this as well, Nadia, is that you guys both saw this as a cause greater than yourself, right? Like something to serve, as a calling, and to really help others, and even at times sacrifice your own self, whether it's yourself or family or whomever. And as a non-clinician, as a guy that's not a subject matter expert in this, I thank you as well, to echo Sajan. And so, but looking ahead, I do want to think about this round 2, not vaccine, but rather this podcast and how this will happen. Whenever that is, I look forward to it.
Oh, thanks. Yeah.
I think we're good.
Yeah, thanks for having us.
I think we really need, if you guys are available in the future, to have some sort of follow-up, how things are changing. I know Vivek, myself, Dave, and Marco are going to join again towards probably the end of February to talk about how we talked about COVID. I mean, we had, for all of us who are in the non-medical field, we had different I would say stance, different idea of when this pandemic would end, when we would see a normal. And
Yeah.
Mhm.
speaking to both you that are in the professionally in this field, I feels like okay, we're definitely wrong.
What
we
did you guys say?
um we
You don't
said
want to
like yeah. I think we said sometime middle of this year. I think May was like part of it.
Hmm.
we were asking the question of who's putting on the brakes, why is this a problem, and they were loaded questions that frankly none of us had answers to, but nonetheless it was enjoyable, and hopefully the listeners
Well, I hope and pray you guys are right. And-
I was just going to say, let's hope that you guys are right and we are totally, totally wrong.
the jury is out on that, but nonetheless it should be.
well, thank you for having us, and yeah, we look forward to coming
Yeah.
on again. And
Oh, definitely. Nadia and
Yeah,
Priya,
absolutely.
Nadia and Priya, do you guys have anything to add?
no, I mean, this was great, and I think it's always good to kind of discuss. I think it was good for us to discuss our experience because we've never really discussed it, only with each other, but not with others. And I think that's always important, is to kind of discuss where we were and kind of where we are now, when it comes to this pandemic, and just moving forward, what we can do to just get the information out there and hopefully get everyone vaccinated and using the proper precautions to have this end soon.
Yeah, I would add just, definitely thanks for having us. And I think it's great to be able to have these conversations, spread the word, hear from each other, hear what everyone thinks. So
Nice.
One thing I would add is, as listeners, we're always looking for the next big thing of what is it, what's going to happen in the future. I think the listeners should have one thing, which is go follow 2sports.com.
Yes, that is the biggest takeaway.
2 sports
We
docs.
are-
They'll be in the description. They'll be shared on my story, shared on my page. Vivek will be sharing it. Please follow them.
Oh, thank you. Yeah, we look forward to creating that community. I know we're definitely interested in just putting information out there.
I think that's very valued. I think that's one of the things that's missing. A lot of people make assumptions. A lot of people try to think that they can figure it out themselves, and they don't get the right information and they run with it, and that's how you end up with misinformation. So,
Right.
all right.
Well, great.
Thank you, everyone. I really appreciate you guys calling in. It was a really great podcast. Delightful.
Thank you.
All right. Thank you, listeners. Please follow 2 Sports Docs.